5 stretches every senior should do before it is too late. Stay until the end because the last stretch is the most important and can change your life. People over 60 years old, pay very close attention to what I am about to say, because this can prevent you from entering a silent process of mobility loss that often ends in chronic pain, functional limitation, and even surgery. There are 5 stretches that every older adult should do regularly before it is too late. And when I say too late, I am talking about that moment when the body has already lost enough flexibility to turn simple tasks into daily challenges. Stay with me until the end of this sequence, because the 5th stretch is one of the most important for preventing falls and preserving your independence. But today we are going to start with the first one, which is the foundation of everything, the hip stretch known as the butterfly. Most people over 60 begin to lose mobility first in their hips, and almost no one notices. The hip is a deep joint, responsible for supporting your weight, absorbing impact while walking, and allowing you to sit down and stand up with ease. When this joint begins to stiffen, the body compensates. The lower back starts working harder. The knees receive more load. Balance gets worse. And you begin to feel that stiffness when getting out of bed or when trying to cross your legs. I have seen dozens of patients ignore this initial stiffness. A 68-year-old woman once told me, "Doctor, I always thought it was normal with age." Months later, she was dealing with constant groin pain and difficulty walking long distances. The problem did not start with the pain. It started with the loss of mobility that was not treated. The butterfly stretch is simple, but extremely powerful when done correctly. You should sit on a firm surface, bring the soles of your feet together, and let your knees open out to the sides. Now here comes the most important detail: keep your spine completely upright. Do not bend forward. Many people make this mistake and transfer the tension to the lower back. Hold your feet with your hands and allow your knees to lower naturally toward the floor. If you want, you can apply light pressure with your elbows, but never with sharp pain. The goal is to stimulate mobility, not to force the joint. And here is something almost no one explains: a stiff hip changes your walking pattern. When the internal and external mobility of the hip decreases, you lose efficiency while walking. Your stride becomes shorter. Your body leans slightly forward. Your center of gravity shifts. This increases the risk of tripping. Studies show that older adults with reduced hip range of motion have a higher incidence of falls. And falls, after age 65, can completely change a person's life. A femur fracture can mean months of recovery and, in some cases, permanent loss of independence. When you practice this stretch for at least 1 minute every day, you are keeping the hip joint capsule hydrated and encouraging the surrounding tissues to maintain elasticity. Breathing is essential. Inhale through your nose for 4 seconds and slowly release the air through your mouth for 6. This activates the parasympathetic nervous system and facilitates deep muscle relaxation. The more consciously you breathe, the more your body allows increased range of motion. If your knees stay very high and you feel excessive tension, place a cushion under each knee to reduce the initial angle. The important thing is consistency. There is no need to force it. Mobility is built through gentle repetition. I want you to understand something very important: aging does not mean becoming stiff. The ones who become stiff are those who stop moving. There is a huge difference between chronological age and functional age. I have followed 75-year-old patients with excellent mobility because they maintained a daily stretching routine. I have also seen 62-year-olds extremely limited because they abandoned movement. If this content is already opening your eyes to something that no one has explained this way before, leave your like now. This helps this message reach other people over 60 who need to hear this before they feel pain. And I want to know, can you sit and cross your legs without discomfort? Write in the comments. This helps me understand your current level of mobility. Now let us go deeper into the second stretch, which complements the work of the hip and activates deep muscles responsible for balance. Because mobility without stability is not enough. And when we talk about the 5th stretch later on, you will understand why it is considered one of the most important for maintaining independence after age 70. The second movement that complements the first and that few people over 60 perform correctly is dynamic hip mobility with controlled leg flexion toward the body. This movement seems simple, but it is one of the most effective for restoring hip function and protecting your lower back. The big difference here is that while the first stretch works on hip opening and external rotation, the second one works on flexion and neuromuscular control. And it is exactly this combination that keeps the joint healthy. You can perform this exercise sitting on a firm chair or lying on the bed if you have difficulty sitting on the floor. While seated, you will slowly bring both knees toward your chest and then return to the starting position. The movement must be controlled, without momentum. Inhale as you bring your legs in, exhale as you return. If you are lying down, bring one knee at a time, gently hugging the leg without pulling with excessive force. The goal here is not intensity, it is functional mobility. Now I want to explain something very important that almost no one talks about. With aging, the synovial fluid inside the joints decreases in circulation efficiency. Synovial fluid is responsible for lubricating and nourishing the joint. It works like a biological oil. But it depends on movement to circulate properly. When you spend many hours sitting or standing still, this lubrication decreases. This exercise works like a gentle pump that stimulates the circulation of this fluid inside the hip joint. The result: less stiffness, less feeling of locking when standing up, and better range of motion while walking. I followed a 72-year-old man who complained that he needed to unlock his hip every time he stood up from a chair. He began doing this movement with 20 repetitions in the morning and 20 in the afternoon. In 3 weeks, he reported that the locking sensation had practically disappeared. This is not a miracle. It is basic physiology applied with consistency. Now pay attention to an essential technical detail: keep your spine neutral. If you lean your torso too far back or excessively round your back, you transfer load to the lower back. The movement should happen at the hip, not in the spine. This precaution prevents unnecessary overload. Another rarely mentioned benefit is that this movement activates deep muscles such as the iliopsoas and core stabilizing muscles. These muscles are essential for balance. And balance is the key to fall prevention. Studies show that reduced hip strength and mobility are directly associated with postural instability in older adults. And here is something you may have never heard: hip mobility even influences your walking speed. Older adults who maintain good hip flexion walk more safely and with fewer lower back compensations. This reduces back pain and improves energy efficiency. You feel less tired while walking because the movement becomes more natural. And do not think you need to do it for half an hour. 15 to 20 repetitions, once or twice a day, are already enough to generate a positive stimulus. The secret is consistency. Now let us connect the first and second stretches. The first opens the hip laterally. The second works on flexion and frontal control. Together, they maintain the joint with three-dimensional mobility. And this is essential because the hip is a ball and socket joint, designed to move in multiple planes. When you work in only one plane, you create imbalance. In the second, we activate dynamic flexion and neuromuscular control. Now I need to talk about something that almost no one directly associates with healthy aging: thoracic spine mobility. And here is a fundamental point: it is not just your lower back that ages, it is mainly the middle part of your back that begins to silently lose mobility. The thoracic spine, located in the region between the shoulder blades, is responsible for rotation, upright posture, and lung expansion. When this region stiffens, you begin to round your shoulders forward, your head moves forward, and your body adopts that hunched posture that many people believe is normal with age. It is not normal with age. It is the result of lack of mobility and proper stimulation. The third stretch you should do daily is thoracic rotation with wall support. This exercise is simple but extremely powerful. You will stand next to a wall. Place a cushion between the knee closest to the wall and the wall itself to stabilize the leg. This prevents the hip from compensating for the movement. Rest your shoulder and hand against the wall. Now, while keeping your leg gently pressing the cushion, perform a smooth trunk rotation, opening your chest and turning your body backward. Inhale as you rotate, exhale as you return. The movement should be slow, mindful, and controlled. Why is the cushion so important? Because if you do not stabilize the hip, the body cheats. It steals mobility from the hip instead of mobilizing the thoracic spine. And the goal here is to restore movement to the thoracic vertebrae. With aging, these vertebrae tend to become stiff, reducing rotation and extension. This stiffness is associated with pain between the shoulder blades, a feeling of heaviness in the back, and even breathing limitations. Yes, breathing limitations. When the thoracic spine loses mobility, the rib cage expands less. This reduces the ability to take deep breaths. And shallow breathing decreases oxygenation to the brain. Less oxygen means more fatigue, less mental clarity, and lower energy levels. I followed a 70-year-old patient who complained of constant fatigue and pain between the shoulder blades. After 3 weeks of doing this stretch daily, she reported significant improvement in posture and energy levels. Posture directly influences your biomechanics and even your perception of aging. Studies show that a hunched posture is associated with a higher risk of falls and reduced balance. When the head moves forward, the center of gravity shifts. Small imbalances become harder to correct. By improving thoracic mobility, you realign the body's axis and enhance stability. And there is another rarely discussed benefit: posture influences mood. Research indicates that people with an upright posture report a greater sense of confidence and energy. Body and mind are interconnected. Now pay attention to the technical details. Your feet should be hip-width apart. The rotation should occur in the middle of the back, not in the lower back. If you feel lower back pain, reduce the range of motion. Do not force it. The movement should be comfortable and progressive. Perform 10 to 15 repetitions on each side. If you have shoulder problems, lower the height of your hand on the wall. The goal is mobility, not joint overload. Now connect this with the first 2 stretches. A mobile hip and a mobile thoracic spine work together to maintain smooth walking and balanced posture. When these 2 segments function well, the lower back suffers less. You begin to understand that the body works as an integrated system, and we are still on the 3rd of the 5 stretches. The 4th will work on global mobility of the entire spine, and the 5th will be essential for preventing leg swelling, improving circulation, and reducing the risk of falls. But before we move forward, I need to make an important request. Now we have reached the 4th stretch, which is one of the most complete for restoring overall spinal flexibility, the movement known as cat and cow. If there is one exercise that should be part of the daily routine of every person over 60, it is this one. Because it mobilizes each segment of the spine in a gentle and controlled way, nourishing the intervertebral discs and reducing stiffness accumulated over the years. Let us first understand something fundamental: the intervertebral discs do not have an intense direct blood supply like other tissues. They depend on movement to receive nutrients. When you move the spine in controlled flexion and extension, you create a kind of mechanical pump that facilitates the exchange of nutrients in these discs. Without movement, the disc loses hydration, loses elasticity, and increases the risk of degeneration. That is why so many people wake up with a feeling of stiffness in their back. It is not just age. It is a lack of segmental mobility. The cat and cow exercise is performed on all fours, with hands aligned under the shoulders and knees under the hips. As you inhale, you arch your spine downward, slightly opening your chest without straining your neck. As you exhale, you round your spine upward, looking toward your navel. The movement should be slow, mindful, and synchronized with your breathing. Inhale as you open, exhale as you round. This breathing pattern is essential because it activates the parasympathetic nervous system, reducing muscle tension. Now I want to highlight a technical detail that makes all the difference. The movement should happen vertebra by vertebra, as if you were creating a wave along the spine. It is not a jerky movement. It is fluid. The slower and more controlled it is, the better the stimulus. Perform at least 20 gentle repetitions. If you cannot get on the floor, you can adapt it while sitting in a chair. Hold your knees, round your spine as you exhale, and open your chest as you inhale. The logic is the same. The goal is mobility, not a specific position. I followed a 74-year-old patient who said his spine was locked like a piece of wood. He began doing cat and cow twice a day, in the morning and late afternoon. In less than a month, he reported significant improvement in flexibility when getting dressed and tying his shoes. This happens because the movement restores elasticity to the myofascial structures. And here comes something even more important: spinal mobility improves neuromuscular coordination. When your spine is stiff, your body reacts more slowly to changes in balance. When it is mobile, your response is more efficient. Next, we mobilize thoracic rotation. Now we are working on global spinal flexion and extension. Do you see how we are creating a progressive strategy? We are restoring three-dimensional mobility to the body? And there is still the fifth stretch, which will act directly on leg circulation and balance, two decisive factors for maintaining independence after age 70. But before we move on to the final section, I need to reinforce something very important: never perform these movements with sharp pain. Mild discomfort is acceptable. Intense pain is not. Stretching is not a competition. It is an investment. And consistency is the key. 5 to 10 minutes daily generate more results than long sessions done occasionally. If you have made it this far and are realizing that mobility is not a luxury but a necessity after 60, leave your like now. This helps this message reach more people who need to prevent problems before pain appears. If you have made it this far, you have already worked on lateral hip mobility, dynamic hip flexion, thoracic rotation, and global spinal mobility. Now we arrive at the fifth stretch, the one many people underestimate but that can be decisive for preserving your independence: the calf stretch combined with a final chest opening for balance and circulation. First, let us talk about the calves. They are called by many specialists the second heart. And that is not an exaggeration. When you walk, your calves contract and help blood return from your legs to your heart. With aging, this muscular pump loses efficiency. The result: a feeling of heaviness in the legs, swelling at the end of the day, a greater risk of varicose veins, and even increased instability while walking. And here is the point few people connect: a stiff ankle increases the risk of falling. When you trip or step on uneven ground, it is the ankle that makes the fine adjustments to maintain balance. If it is stiff, your ability to react decreases. The stretch is simple, but it needs to be done correctly. Stand facing a wall and place your hands on it for stability. Step one leg back while keeping the heel fully supported on the floor. Lean your body slightly forward until you feel the stretch in the calf of the back leg. The heel cannot lift off the ground. This detail is essential. If the heel rises, you lose the stretch of the gastrocnemius. Hold for at least 1 minute and then switch legs. Breathe deeply during the movement. Do not bounce. Do not make sudden movements. Now understand what is happening physiologically. By maintaining this stretch, you improve the extensibility of the gastrocnemius soleus complex, increase ankle dorsiflexion range of motion, and improve venous return. This reduces the feeling of heaviness in the legs and improves stability while walking. Studies show that older adults with greater ankle mobility perform better on balance tests. And balance is synonymous with independence. I followed a 73-year-old man who reported insecurity when walking on uneven sidewalks. He began stretching his calves daily for 2 minutes on each side. Within a few weeks, he reported more confidence and less feeling of heavy legs. Small changes generate big results when done consistently. Now let us complement this fifth section with the final chest opening, because balance does not depend only on the legs. It depends on the body's overall alignment. If your shoulders are projected forward and your head is forward, your center of gravity shifts. This affects your stability. Interlace your hands behind your body or use a towel if you cannot. Slightly raise your arms and open your chest, keeping your chin parallel to the floor. Do not throw your head back. Now connect the 5 stretches. The first restores lateral mobility to the hip. The second restores dynamic control and flexion. The third opens the thoracic spine and improves posture. The fourth mobilizes the entire spine and nourishes the intervertebral discs. The fifth improves circulation, balance, and final alignment. This is not a random sequence. It is an integrated strategy for preserving mobility after age 60. And here is the most important message: aging with stiffness is not inevitable. Aging with severe limitation is often the result of abandoning movement. 5 stretches. 10 to 15 minutes a day. This is the investment that can keep you independent for many years. If this content made you realize that there is still a lot that can be done for your body, leave your like now. This helps other people your age receive this guidance before more serious pain appears. And I make a special request, send this video on WhatsApp to your friends, especially those who already complain about hip, back, or leg pain. Often, the difference between maintaining independence and losing it begins with a simple decision to move today. Start slowly. Be consistent. Do not do it with pain. Respect your limits. And within a few weeks you will feel your body lighter, more stable, and more confident. Mobility is freedom. And freedom, after 60, is one of the greatest gifts you can preserve.